herding cats. First they get Martha in the room, and she's out of the room, and she disappeared, and it's like, where are you?
So we have Ginger Lott, we have Dr. Guarini, Martha and Cindy and Mary Sherry and
Me.
yeah, I forgot your name. John.
David.
Are you recording this, Sharon?
David. Maybe I am, maybe I'm not.
If you're recording it, then we're not going to do it. We'll go to court.
Well, you're gonna do what you want to do. I'll turn it off.
No, I asked Dr. Bruni here in case y'all had any questions, because I'm very conscious of the fact that she is y'all's mother. She's not my mother. But if y'all have any questions as far as your mother's prognosis or where she's at this time, and I thank Dr. Bruni for being here to answer any questions y'all have. I'm just here to help facilitate and keep your mother's wishes done to what she wanted done.
Well, Dr. Guarini, will you explain to me when Mother went into the hospital, what was she diagnosed with? When she left here Wednesday.
From what I understand, of course I didn't go to the hospital, they found that she had pneumonia, and they treated her.
She also had a UTI infection.
UTI, okay.
Yeah, okay. How did they treat her?
Antibiotics. He wasn't involved.
He wasn't involved.
You're the head doctor here, and I guess you would be the head doctor for Mother. She's being treated, right?
Well, I don't know that. Do you have privileges at Kingwood?
Yes, but I have a doctor that goes.
Right, does that, yeah, Dr. Mahad.
So you can't really talk to what they did.
Right, I just know
But
he came back without IV,
Mm-hmm.
and you're going to fill me in on that because apparently you talked to somebody there about giving her an IV here.
No, did.
When she left here Tuesday, Mama was sick, and I walked in Mama's room immediately. I knew she had a UTI, where she was acting. She was dehydrated and had a UTI. I went to the nurse's station and asked them, did they know Mama was in trouble? And they told me I had to talk to Ginger. And I knew that was going to be a worthless cause. But anyway, I asked them to please look at Mother. And I texted you, I called you, I can't remember, that Mama needs for you to be down here. And I was told that she was taking off medication and that it was a result of medication at that time. And then Mother calmed down a little bit, and I went home, and early in the morning I found out that she was transported back to the hospital, and Ginger put it for pneumonia. And when I got there, first of all, I couldn't understand nobody, which is really hard to communicate with people who don't speak very good English. But the doctor, Ray, or whoever he was that was treating Mother, was not even more interested in treating Mother than the man in the moon. He didn't want to just keep her comfortable, and he asked me what I wanted to do. And I told them, and I told Ginger and everybody else for the last year, that Mother could not take that Exelon patch, she could not take the statin drugs or the warfarin, none of this stuff because she takes, because it does this to her, and they did it anyway. So that being said she has suffered these leg cramps, and she's suffering today for these leg cramps, which never been addressed. And it's not about the pneumonia. I'm not saying it's not Mama's time to die, but nobody has even looked at Mama's best interest of those leg cramps. And there's nothing that I can say or do. In the beginning of this guardianship program, it was done against Mama's will. It was done against mine and Cindy's will. We didn't want this. You evaluated Mother in 2008 and declared her mentally incapacitated, and she was screaming and hollering for you not to do this. Y'all did it anyway. Larry was involved in this, you was involved in this, and Ginger, I think, was court coordinator at that time. Or you worked for David, one of the two. Mm-hmm. But anyway, all throughout this ordeal, everybody knew that Mother was put into guardianship illegally without due process. And Mother has never had a day of peace, of freedom to make choices in her life since this has begun. And at this point, she didn't be asked to be treated like this along the process. And we asked Ginger and them not to do this to Mother, and they did it anyway. And at this point right now, we have no say-so in the matter. Mother dying, it's going to be on your hands and Larry's hands and Dr. Green's hand for putting everything in yes. I'm not going to tell you that I'm for this or against this. But I say to you, Ginger Lott, that God himself is not going to take lightly to you what you did to Mother. And what Dr. Guarini did and what Miss Butts allowed to have happen. Mother's going to pass on with or without my blessings. You're going to make that choice. I'm not going to say I'm for this or against this. You prayed God in this thing and you're going to make the choice.
I pray God every night, guys.
You do that because Mama's blood is on your hands. And Dr. Guarini, I would like for you to have a copy of the letter I sent you and your email address. So y'all do what y'all want to do.
So you don't have any questions for Dr. Green?
It doesn't matter. It doesn't matter one bit, Ginger.
Okay.
Okay. Well, what are the decision points here? I mean, you don't have any questions for Dr. Greeny.
It doesn't matter. It doesn't matter. I
So
said.
I don't see any reason for Dr. Greeny to have to stay when he can make rounds and.
That's right.
and
Well,
treat
I wanted to
patients,
ask
but-
you questions. Okay, so what you were telling me, if we gave her like an IV to hydrate her, it would make it even worse.
I wouldn't put an IV in because that's painful for her and she'll probably pull it out because she's in right now hypoactive delirium.
Okay.
The other day she was hyperactive delirium, brought on probably by the UTI or
The leg cramps.
pneumonia. So you could put in a sub-Q line any place and run in some fluid that way. If she pulled it out, you just stick it in again. You don't
That's
have to
causing
worry
more
about
pain.
that. Huh?
She doesn't need to be pain.
Okay.
That-
That's just more pain.
Well, what would be
Well,
what would be the benefits of that?
To keep her from dehydrating.
All right, but you're going to dehydrate her on one end, and y'all talking about putting her on hospice on the other end. So you're going to hydrate her
Okay.
on one thing, and then you're going to overdose her on morphine on the other end.
The benefits for hydrating her right now would be that you might be able to get her out of the delirium because her delirium right now is produced probably by the toxins in her system
Right.
that she can't get rid of.
Right.
So by putting in a fluid maybe for 4 or 5 days or as long as we could into the subcutaneous tissue, it might clear her up a little bit so that she could talk to you because she can't talk to you now because she's delirious. So that would be the only thing and reason why you would want to put an IV in. It's not going to prolong her life, and it might even make her less comfortable because that fluid can't get out of her system. So she's going to have a lot of gurgling in her. It's called the death rattle. So she
Drowning.
can't- excuse me?
Drowning, basically.
No, she's not drowning. It is fluid that comes from the saliva. Right now she's not making very much saliva. So when we give her fluid, she's going to make saliva, and the saliva is just going to go right here, and it's not going to go down. And every time she breathes, it's going to go up and down. Now if we give her too much fluid, then the fluid from the lungs would go up, and that would be drowning. But we would never give her that much. We can give her more than 500 a day.
But what is it way out on her comfort zone? With the IV being stuck in her leg, her
Well, they're
hurting
not
so
gonna-
much and the cramps and everything.
Well, you're not going to
she's
address
got.
no issues. I mean, the point is, if you give her an IV or whatever you did, you're not going to address the leg cramp issue. You're not going to address the UTI. You're not going to give her any antibiotics.
Well,
nothing
any
like that.
medicine that we give her is going to be delirium. It's going to cause delirium. Right now, she has the chemicals in her brain are not working like yours and
Because your electrolytes, your toxic electrolytes.
That's exactly right.
Her body's poisoning itself and shutting down.
That's right.
Basically, that's what it is.
Yeah, we're not going to do much. It's just what I told you. Maybe you get her out of delirium, she could talk to you, but no, you're not going to prolong anything.
I mean, but what's it going to balance out though? Getting her out of delirium where she can talk to us versus the pain that
Well, I'm
she's
not even
gonna
so
be
sure
in.
she could talk to you. She
Yeah.
wasn't talking to you before, was she?
She did, yes, she
So
knew.
what
We
must
talked
have-
a little bit, but she slept mostly.
Yeah.
She would be, because the leg cramps, she was having the
Well,
leg cramps real bad. And
I'm
that's
not
what
in
made-
favor, but if the family felt, actually I'd be treating the family, not the patient. But maybe that's what the
I
family.
can't see it because mother is, because I can imagine sticking something in her growing area.
No, we're not gonna stick anything in
An
her.
idea or something.
No, it would be in this part here, in the fleshy part,
Oh, no, it's
Just
just
not
gonna
no
put
more
it under the
flesh.
skin.
under the skin. That's
That's
right.
all it is, kinda like.
Can you do that? I can't do that. Okay.
Well, like I said, I can't see it because all you're doing is just building up fluid underneath the
Right,
skin,
no,
causing
we
bruising
wouldn't
and
be,
bleeding
we
and
wouldn't
stuff.
be changing the course.
Everybody has absorbs it through the skin and the muscles is what it is.
Right, it's absorbed into the tissue.
Yeah, kinda like a
not-
diabetic bend, yeah, a shot or
Yeah.
something, tissue absorption.
It's absorbed much slower.
Yeah, but the pain though, with the
Immediate.
swelling and everything, basically would be over time.
Yeah,
What
but-
the effects it would really give, the benefits. and
It's
everything.
questionable whether there's a benefit for her. The benefit is.
Well, that's what I'm
more
looking at, like this is, I don't want to pass on or anything, and I don't want her to hurt no more, because that's one of her wishes, that she always says, I don't want her, she has watched her brother suffer tremendously, her sister-in-law suffer, and that's been one of her worst fears, what she's going through right now. It's Mama's worst fear of hurting, and I see her hurting.
Okay, well, that would be the goal of hospice, would be to keep her from hurting. Now, we can keep her from hurting, but that's only one aspect. Hospice will bring in some counselors for the family
We don't need that.
and explain the process of dying.
We know, we've
Which
held
we
many
think-
people's
Yeah,
hands.
we've been through this before with the houses and everything. It's just, what worries me about the house is strangers. That she, because she
What if
sees
the-
me come in, she does give a reaction.
Let me
ask
ask you this, what would be the point? Mother has skilled nursing care there. She has her children who wants to participate if they wanted to, and her grandbabies. She has Nicole and Andrea sitting there during the day. Y'all can administer the pain medicine. I mean, why would we bring hospice into the program and charge Medicare $13,000 when they're not going to be doing any more than what Meredith's doing here?
But they would be doing more.
Well, explain to me what would be the difference.
Well, there's a lot of issues out there that need to be addressed and that need to
Such
be
as?
addressed by somebody.
Such as?
Well, I think conflicts among the family members.
It don't matter. We don't have
It's gonna be
control.
there to the day she dies.
Dr.
She
Guarini,
passes
see, you
on
don't
to the
understand.
Lord.
We have no control over this situation. We don't have control of mother's death. We can bless it or we can curse it. Don't matter. It sits right there. You need to talk to her, not us, because it doesn't matter.
But hospice has other issues.
I don't care about
Spiritually-
hospice. I'm a Christian person. Mother is saved. Cindy's saved. We're all saved. Whoever's saved. I don't need counseling. I don't need hospice running up more, meddling, doing nothing, having more people. Mom's got enough stuff going on. We can handle Mama's death. We're grown people. And like I said, this is not our call. This is her call. You don't have to worry about the family. You don't have to worry about Larry or me or Cindy or the grandchildren. We're fine. We understand what is going on. And we have, like I said, we don't have a choice in the matter. You know, if we had a choice, we would handle things differently. But we didn't have that choice. It wasn't given to us. Ginger wanted that choice. She took it, and she's going to deal with it. That's all. That's the way it should be. If she wants the hospice be in, she can do whatever she wants to. If she don't have to. It is her choice.